I would like to introduce a panel of advisors here who have worked on our recovery plan. To my left is Dr. Ricky Hernandez, and he's the Deputy Administrator of Guam Economic Development Authority. Dr. Felix Cabrera, who is the Medical Director for GRMC and also a member of the Physician Advisory Group. Dr. Mike Cruz, who is the CEO of GRMC and also the Surgeon General for our COVID-19. Dr. Hua Huyn, who is the president of the Guam Medical Association, but more importantly, the chair of the Physicians Advisory Group. Thank you for being part of this press conference. As of last night, we have 145 confirmed cases of COVID-19. Of those cases, there have been 5 deaths, and 131 have been released from isolation, which means we have 9 active cases. We didn't get here because of luck or fate. We are here because each of you chose behaviors which stopped the spread, flattened the curve, and saved lives. As I have said to you before, we remain in a public health emergency, and today I will sign Executive Order 2020-11, acknowledging that this emergency continues. This extension does not prevent me from relaxing any current restriction, but it is necessary as long as some measures remain to prevent further spread of the virus. While we cannot immediately return to life as it was before COVID-19, we have entered a new stage in Guam's long road to recovery. Through Executive Order 2020-11 and with my recovery panel of advisors, we have established the Chalan para Hinemlo plan, which is based upon available medical data and our ability to contain the virus if we see a new surge. Our plan will open Guam's economy gradually in order to mitigate the risk of resurgence and protect our most valuable population and vulnerable populations. There are 4 phases in Chalan para Hinemlo called Pandemic Conditions of Readiness, or PCOR. These conditions of readiness describe the strictness of our measures. Our decision to move from one condition of readiness to the next will be informed by specific circumstances and triggers. PCOR 1 describes the maximum alert or the strictest measures implemented to prevent rapid spread of COVID-19. These include the prohibitions and closures of non-essential activities, quarantining of inbound travelers, and actions meant to deter people from engaging in non-essential activities. In PCOR 2, we will have moderate levels of restrictions. We would all still be required to wear face masks and practice strict social distancing, but we can begin to reopen some non-essential government operations and businesses like retail stores, with an emphasis on ensuring their processes and procedures are adjusted based on public health guidance. As I stated earlier, certain criteria need to be met before entering a new condition of readiness. To inform my decision to move from PCOR 1 to PCOR 2, we must meet the following criteria. 1, we must have 2 weeks of consistent decline in the number of new COVID-19 positives. 2, we must have an adequate hospital capability to treat new cases as they arise. 3, we must have the capacity to test people with COVID-19 symptoms. And 4, we must have the ability to contact trace efficiently and effectively. Based on the data we have, the current 14-day window we are considering began on April 25th. This means if all other criteria are met, Guam will accomplish the goal of reaching PCOR 2 by May 9th. I want to reiterate that May 9th is a goal, not an absolute certainty. We will not rush to meet fixed deadlines. Instead, My decisions will be based on evidence and our ability to manage the threat of COVID-19. Anything else would jeopardize human life and risk an even longer period of recovery. But because May 9 is a little more than a week away, through my recovery panel of advisors, I have asked our partners in the business sector to begin preparing immediately. To transition from PCOR2 to PCOR3 means we must make even greater progress. Rapid testing must be achieved not only for our residents, but for all travelers to Guam. We must maintain our downward trend in case positives over a minimum of 28 more days after PCOR2 is declared. PCOR3 will have minimum restrictions that we will determine at a later time, and additional businesses and government operations may be opened. To achieve a PCOR4 status where restrictions are no longer necessary, a vaccine must be developed or there is sufficient evidence of mass immunity has occurred. I know that each of you must have questions about the type of data I will use to make these decisions, the public or private services that will be allowed to open under each condition of readiness, and how business owners can prepare to reopen responsibly. That is why I have asked Dr. Ricky Hernandez, chairman of my recovery panel of advisors, Dr. Mike Cruz, my chief medical advisor and state surgeon, and Dr. Felix Cabrera, a member of my physicians advisory group, to present our plan in further detail. Additionally, public health will be publishing detailed guidance to our business community next week. Though this process have not always been easy, though we have shared our good days and bad days, and though we will likely have more challenging days ahead of us, Guam will survive. And Guam, we will grow stronger because we have come together. I'd like to now hand it over to Dr. Ricky Hernandez to now make the presentation of our Chalan para Hinemlo.
All right, thank you, Governor. Hafa and good afternoon, everyone. My name is Ricky Hernandez, and I'll be representing the Governor's Recovery Panel of Advisors in presenting Guam's Chalan para Hinemlo Road to Recovery Plan. This plan presents a roadmap to help us navigate through these uncertain times. As we are all aware, the 2019 novel coronavirus, also known as COVID-19, has had a detrimental impact to not only Guam's economy, but the world's economy. This plan was crafted from review of previous reports and studies, such as the Opening Up America Again guidelines, but tailored to the unique circumstances Guam faces. More importantly, this plan was crafted with members from both the medical and business communities, which provide varying perspectives that truly inform the final guidelines I'll be discussing today. On the next slide, as an overview of this presentation, I want to ensure that we stay on path. The three main parts of this presentation will be directed by answering three main questions, which are, when? When do we know to begin reopening our economy? Second question, what? What business, non-governmental organizations, government, and individual activities should reopen? And how? How will businesses, NGOs, government, and individuals operate when reopening occurs? On our next slide, the idea of a proposed phased approach has been mentioned in several plans and reports being discussed throughout the nation. First and foremost, this road to recovery plan was driven specifically by medical data and public health preparedness information. This information guided the entire plan to ensure that we are able to mitigate the risk of resurgence of COVID-19 in the community. And the plan also intends to prevent our healthcare system from being overwhelmed. What is also important is how we all understand this plan to ensure that this new normal we are living in incorporates something familiar, something we have had success in overcoming. In the next slide, as many of us have experienced, condition of readiness levels or PCOR levels. The top level, PCOR 1, indicated In red is a pandemic condition of readiness level we are currently in. It represents the maximum restrictions in place to include the closure of non-essential business, government, and individual activities. The next PCOR level is PCOR 2, indicated in orange. This PCOR level 2 indicates a moderate level of restrictions. What this means is that there is an expectation of gradual lifting of restrictions. The next level of PCOR 3 indicated in yellow. This PCOR 3 level represents minimum restrictions before we are able to get to PCOR 4. PCOR 4, like condition of readiness 4, is what we may be able to consider normal circumstances with no restrictions. And so this plan basically utilizes and adapts the system of condition of readiness as it relates to typhoons into what we're calling the pandemic condition of readiness levels, or PCOR levels. So PCOR 1 is where we begin our journey, and in echoing the sentiments of the governor, we would not be here without the diligence of every single person in the community that both trusts and respects one another through their actions of maintaining social distancing, wearing a face mask if possible, and practicing good hygiene. This brings us to discussing the concepts that will allow us to understand how we get from one PCOR level to the other. On the next slide, the two main concepts that I'd like to briefly discuss are what we call triggers to inform a decision by the governor to move into the next PCOR level. These triggers are broadly categorized into medical data on the left and public health preparedness on the right. Medical data includes cases, which is the statistical data relative to positive cases of COVID-19 on Guam. This is essentially the data that is reported on a daily basis. Hospitalization is a level of hospitalized individuals due to COVID-19 at both our local hospitals. On the right side, public health preparedness is made up of two very important concepts. Testing, which is Guam's capacity and capability of testing for COVID-19 positives on Guam. The more Guam is able to test, the more we are able to identify potential cases and perform robust contact tracing and surveillance. Which brings me to contact tracing, which is the Department of Public Health and Social Services capacity to conduct adequate monitoring of COVID-19 cases and tracings of their contacts. Testing capacity and contact tracing capabilities are key factors in being effectively able to address any future surges in cases. On next slide, discussing these four triggers now brings us back on the road to recovery plan, which answers the question when. When can we begin to reopen the economy, and what are the triggers to inform a decision that is based on medical data and public health preparedness capabilities? And on this next slide, I'd like to pass this over to Dr. Cruz and Dr. Cabrera to discuss the triggers to inform a decision to move to a next PCOR level.
Thank you, Dr. Hernandez. Good afternoon, Hafaday people of Guam. Dr. Cabrera and I would like to discuss further the triggers to inform a decision by the governor to move from PCOR 1 to PCOR 2. And it is based on the four criteria that must be met, as you can see on the slide before you. These four criteria are cases, hospitalizations, testing, and contact tracing. We have to stress that these are not triggers to tell the governor to act or forces an action. Rather, these triggers are only meant to inform a decision that the governor ultimately will make. Under cases, as you can notice on the slide, the trigger to inform a decision is when there is a downward trend of confirmed cases and a downward trend of positive tests as a percent of total tests within a 14-day period, utilizing a 5-day rolling average. You notice next to the word cases is an asterisk. I will bring your attention to the bottom of the slide where it states that new positive case variations that stay below 5 per day may still be considered a stable state of pandemic. This is an example of the balancing balancing of public health priority with achievability. Are these triggers achievable? This is what the recovery panel of advisors sought when deciding on these triggers. Medical data and public health preparedness were the main drivers of these triggers, but it was important that they were also achievable while still maintaining and upholding the priorities of Guam's overall public health and the risk of spread. Under hospitalizations, the triggers that Guam hospitals, both GRMC and GMH, are able to treat all inpatients without resorting to alternate standards of care due to COVID-19 cases. Under testing, the trigger to inform a decision is when Guam has the capacity to test all people with COVID-19 symptoms. Lastly, under contact tracing, the trigger is when the Department of Public Health and Social Services has the capacity to conduct adequate monitoring of all COVID-19 cases and tracings of their contacts. You may be wondering, where are we now as it relates to these 4 triggers? Have we achieved any of them? I'd like to pass the mic over now to Dr. Felix Cabrera to discuss Guam's current COVID-19 trends. Dr. Cabrera.
Thank you, Dr. Cruz. Next slide. So as you can see on the slide before you is a where we are as of today, April 30th, but the data more recently as of yesterday. So Guam's COVID-19 daily new cases and hospitalization census is seen here. This is using a 5-day rolling average as well, what was mentioned earlier. In the teal line here is represents the hospital census of COVID-19 since the beginning and as it is today. The orange line represents the daily new COVID-19 cases. As mentioned earlier by the governor, that the window that we are looking at right now is begins on April 25th. So, but overall, it does meet what was earlier stated that cases below 5 are considered to be stable. So as it fluctuates under this, we are still in a good place. On the next slide is the Guam's COVID-19 daily tests performed and the rate of positive results we get from them. And so you can see in the very solid blue part of the graph is the number of daily tests performed. And as you can see here, yesterday was our highest day overall, where we tested well over 160 patients. The line down here in the solid orange is the daily test positivity rate. And again, that's the number of tests that turned out positive for how many tests you did that day. Ideally, we want to keep this below 3%, which is similar to how a lot of successful countries have been able to test appropriately to control their pandemic. But overall, we'll be using a 5-day rolling average, and that's what this dotted line is here of the daily total positivity rate. So overall, we've been staying well below 0.5%, so we're in good standing with that as well. So I'll return to back to this slide here and discuss the rest of moving from PCOR 2 and forward. So the triggers to inform a decision to move from PCOR 2 to PCOR 3 involve the same 4 criteria. The triggers of hospitalization and contact tracing must remain consistent or be better than from the time PCOR 2 was declared. You'll notice the difference in cases and testing. Under cases, the trigger to inform a decision is a downward trend of confirmed cases and a downward trend of positive tests as a % of total tests within a 28-day period, utilizing a 5-day rolling average. With the key here that this window starts on the day PCOR 2 is declared. This period of time is necessary because typically the decisions regarding restrictions and the actions taken by the people have a delayed response in our medical data. Therefore, the 28-day period will provide the best and most informed decision to the governor, as the medical data will reflect the impacts of the move from PCOR 1 to PCOR 2. Under testing, Guam should continue to have the capacity to test all people with COVID-19 symptoms. The additional requirement is that there's an availability and the affordability of rapid and reliable testing of travelers as it relates to quarantine. What this means is that the rapid and reliable tests in whatever form is necessary to begin to consider either the lifting of travel quarantine requirements or what may be the more favored addition of exceptions to the traveler quarantine requirements. These exceptions could be that the traveler are tested at the place of origin or upon landing on Guam. There will be a lot of questions about this, but rest assured, when the island gets closer to that eventuality of having that testing capacity, these details will have been worked on and be more clear and in all likelihood be more evolved at that point. We believe that the most important aspect of this is what a prior study had mentioned. It stated that tourism may resume at some level if 2 conditions are met. The first is that the potential visitors would have to perceive the destination as being safe. The second is that the residents of the destination where visitors will be arriving can be assured those visitors are not infected with COVID-19. Once rapid and reliable testing is available and affordable at a much wider scale, these triggers to inform a decision to move from PCOR 2 to PCOR 3 could be a reality. Lastly, the trigger to inform a decision to move from PCOR 3 to PCOR 4 is related to immunity. Do we have the ability to confer adequate immunity on Guam, either by mass administration of an FDA-authorized vaccine, if ever developed, or is it possible to confirm herd immunity has developed via natural disease and recovery to prevent another outbreak? The reality is that it may take months for this to happen, and that we may continue to live in a PCOR 2 and PCOR 3 environment until this trigger can be achieved. And now I'll return it back to Dr. Hernandez.
Thanks, Dr. Cabrera. So to continue on the road to recovery plan, the next question to answer is what? What business or non-governmental organization, government, and individual activities will be authorized? We'll focus mainly on what will occur during PCOR 2. And on the next slide, this slide specific to businesses and NGOs and identifies those activities to be authorized upon declaration of PCOR 2. Let me reiterate that all essential businesses and activities already authorized in PCOR 1 will remain. These specifically identified business activities such as retail operations, real estate and automotive sales, salons, shopping centers and malls, and elective medical and dental procedures, treatments, and therapies are expected to be authorized upon PCOR 2 declaration. I want to ensure that it is made very clear, and I'll point to the note on the bottom of the slide that states all businesses and NGOs will be operating on a limited basis and will require adjusted operating guidelines to be submitted by industry representatives to the Department of Public Health and Social Services prior to business opening. We will go over this in more detail in the next few slides. On the right side of the slide, you'll see a list of business activities that will be under review either during PCOR 2 or during PCOR 3. These business activities, such as restaurants, sit-down restaurants, gyms, spas, bars and clubs, bingo halls, etc., are not expected to be authorized upon declaration of PCOR 2, but could be authorized at some point, either during PCOR 2 or in PCOR 3. I'd like to make it a point to say that this is not an exhaustive list of all business activities that are expected to be authorized or are under review. That list is expected to be released next week under guidance from the Department of Public Health and Social Services. If there are any questions of other business activities that are not on this list, a more exhaustive listing is expected to be released next week. And moving on to the next slide. This slide references the intended Government of Guam services that will reopen in PCOR 2. Priority was placed on government operations related to commerce, which include those agencies operating in the Business License and Permit Center. Other government agencies and services are also expected to be opened, which involve customer-focused services. Just as important as business and NGO activities, government operations have already been planning its operations around social distancing mandates, with physical workspaces or workplaces already being modified, employees being trained, and other actions necessary to ensure public health is upheld. And lastly, K through 12 schools and higher education institutions continue to be closed in PCOR 2. And the next slide. So the last question we have on our road to recovery plan is the how. How will businesses, NGOs, and governments operate, and what do individuals have to continue to do as we move into each PCOR level? On the next slide, in PCOR 2, there are responsibilities that businesses and NGOs, government agencies, and individuals must adhere to. These include the wearing of face masks, social distancing, and ensuring special accommodations are made for vulnerable individuals, either in the workplace, as a customer, or at home. Prior to the possible declaration of PCOR 2, it is incumbent on the businesses and NGOs to work together to submit to the Department of Public Health and Social Services adjusted operating guidelines at an industry level that are based on U.S. Department of Labor and Occupational Safety and Health Administration OSHA guidance on preparing workplaces for COVID-19, as well as industry best practices. In discussions with the Recovery Panel of Advisors, representatives from the Chamber of Commerce and the Women's Chamber of Commerce will be working with their membership as well as other industry sectors to assist in crafting such adjusted operating guidelines for submission. The submission of industry-specific guidelines instead of individual business guidelines will assist the efficient but safe reopening of identified business activities by preventing the need for each individual business in submitting an adjusted operating plan. Additionally, the submission and not necessarily the approval of the Department of Public Health and Social Services of such adjusted operating guidelines will prevent the unnecessary wait time that may occur for approval. So I'd like to reiterate what the governor mentioned at the start of this briefing. We're only able to discuss the possibility of reopening because of everyone's concerted effort to prevent the spread of COVID-19. I think in that same vein, as we possibly move into PCOR 2, we all need to continue that effort even more. And if there is a business that may not be practicing social distancing or sanitation requirements, that this process be one of self-regulation. Additionally, limited occupancy rates will be determined and established prior to the possible PCOR 2 declaration, and certain public gatherings or congregations to be determined for specified purposes will continue to be prohibited. Similarly, with government services, they have already been working on adjusted operating plans for the customer-focused agencies to ensure social distancing mandates are upheld. And like I said earlier, physical workplaces are being modified, employees are being trained accordingly, and other actions as deemed necessary are being undertaken. Furthermore, individuals must continue to practice good hygiene. Wash your hands with soap and water or use hand sanitizer. Avoid touching your face, sneeze or cough into a tissue or inside your elbow, and frequently disinfect items and surfaces that are used. The last item I would like to identify on this specific slide is the wording in parentheses at the top. Use this time during PCOR 1 to begin planning. It is incumbent on each business to work with the Chamber of Commerce and the Women's Chamber of Commerce or other organizations that represent different industries to prepare and submit adjusted operating guidelines. Government continues to plan and similarly work out adjustments to its operations to lower the risk of spread of the virus. So the role of the Department of Public Health and Social Services is integral to the entire PCOR process. Just like the National Weather Service advises the governor on wind speed and timing of when such speeds may occur on Guam during a typhoon emergency, the Department of Public Health and Social Services will advise and inform the governor on emerging medical data and public health preparedness levels related to the triggers previously discussed. I'm pretty sure that there will continue to be questions as it relates to this process, and I'd like to thank the identified organizations below on this slide for their assistance in answering questions related to the opening of businesses and NGOs. Please refer to the information below if there are any such questions. And lastly, on behalf of the Recovery Panel of Advisors, we do understand that this is not a perfect plan, and it may not please all parties. But we will continue to obtain constructive feedback and comments on how we can continue to improve this process while protecting the health and safety of everyone. This is a first for all of us, and we thank everyone for your diligence and patience while this plan was being prepared. And with that, thanks, Governor.
Thank you, Dr. Hernandez. Before we open it up to questions, I'd like to now take this opportunity to sign our Executive Order 2020-11. And this executive order is relative to extending the public health emergency and establishing the pandemic conditions of readiness system. What it will do is it'll extend the public health emergency that is scheduled to expire on May 5th for an additional 30 days. It will establish the pandemic conditions of readiness, which is our recovery plan. And it also announces that our pandemic condition of readiness 1 is what we are currently in. And that, again, to reiterate, is closing of all schools, mandatory social distancing, restricting entry into Guam. Emergency measures concerning facilities and materials means that essential businesses and government agencies shall require their employees and patrons to wear face masks while on their premises. It also is it continues to require Government of Guam operations in a limited capacity and only for essential. And it will continue the closure of public parks and beaches. And it will also address price gouging. Additionally, it will allow open government and participation in meetings via teleconferencing. And lastly, it is ordering and requiring reporting regarding reduction in workforce or employee hours to the Department of Labor in order to process benefits for affected employees. This executive order is signed and promulgated at Hagåtña, Guam this 30th day of April and signed by me and also attested by our Lieutenant Governor. I will now open it to questions.
Thank you, Governor. Before we open the floor to questions, just a reminder to please keep your questions relevant to the COVID-19 recovery plan. Also a reminder, you get one question and one follow-up. We'll begin with KOAM, Master Lecanto.
Good afternoon, Governor. Good to see you. We missed you.
It's nice to be missed. Thank you.
First question, I guess is for, might be for Ricky. So I guess if all goes well, we're looking at going to P-Core 2 on May 9th, and then 28 days after that, if all goes well, P-Core 3, which would essentially be the day that we're able to restart tourism, accepting visitors. Is that correct?
Yeah, that's correct. And I think to set the expectation is that P-Core 3 and the determination for that is really based upon all of those items that we talked about from P-Core 1 to 2. But what might drive that is the testing capacity. And so that without that testing capacity, I think in terms of being able to achieve that P-Core level, we should probably set the expectation appropriately. And also,
right.
There's also some. There may also be some considerations moving forward when we get to P-Core 3 that we may not have seen or foreseen today, and so this plan is very flexible in terms of what may occur in each of the P-Core levels. And so hopefully that will when that time comes, we'll be able to know more than what we know now and make a better informed decision.
Okay, so my first question is, if we falter in any way before that June 7th date, does that restart the clock?
Yeah, and I think that's a good question. And the recovery panel of advisors and as well as the physician advisory group had discussed what may occur in terms of if we regress or things don't continue to get better. And I believe that those circumstances, as they arise, is something that we're going to be closely monitoring. And I think there isn't any specific guidelines in terms of how to move back, but we're also ensuring that those things, as the data shows, and as hospitalization information occurs during these different P-Core level periods. Those decisions will be made at the appropriate time, but the guidelines are moving from P-Core 1 to 2 to 3 to 4, and if in the event there needs to be a move backwards in P-Core levels, those decisions obviously will be made when the data shows that.
Thank you, Lester. Next is COT Kevin Kerrigan.
I'm sorry, I can barely hear what's being said. Can you hear me?
We can hear you.
Yeah, I'm not able to hear anything. Can you turn up your volume?
Can you hear me, Kevin?
No, I mean, can faintly hear you asking, can you hear me? Faintly.
Can you test your microphone?
Test.
Can you hear Ricky?
Yeah, it's much better. I hear you clear as a bell now.
Okay, thank you.
Yeah, the governor signed the extension of the emergency declaration, and her volume was very low, and I could not hear what restrictions will continue. So, Governor, could you tell us what restrictions will continue under the emergency declaration you just signed?
So right now, Kevin, first it extends the public health emergency to an additional 30 days. And then because we are in PCOR 1, the current restrictions are still in place.
And Kevin, we'll provide you with a copy of the executive.
And again, Janella, your volume is very low. So the 14-day quarantine remains in effect for 30 days after May 5th. Is that correct? 14-day quarantine for all arriving passengers. Is that correct?
Yes, the quarantine procedures and protocol will still be in place.
So that effectively kills the tourism industry until June. Is that right? We won't be able to see. Philippine Airlines has said they wanted to start flying again on May 15th, but if we keep that 14-day quarantine in place, they really won't want to fly here until June, is that right?
Right. So, Kevin, the decision to lift quarantine or the decision to lift any of the measures that we have in place or any of the restrictions is going to be based on data. And it's going to be based on our ability to meet all those 4 criteria. But I have said to the tourist industry that probably the last measure that we will probably be looking at lifting would be the quarantine or the restrictions on entry into Guam.
Okay, just with reference to that issue, Pilar Laguana has written to the legislature today seeking immediate help to revive the tourism industry. What assurances can you offer the Guam Visitors Bureau that you'll do all you can to enable that?
First of all, I don't know what help she was asking for. And of course, our economy, Kevin, is based on tourism. I will do everything I can to provide support and help to revive our tourism. But the foremost interest and the most compelling interest is the health and safety of our community. I cannot go forward with any kind of without being assured that our community is healthy, safe, and our ability to contain and even possibly eliminate the coronavirus is in place. And that we are assured that our measures that we are doing will protect that. So to me, an economy cannot be there if we do not have a healthy community. And yes, there is a balance that we have to look at with both the health of the economy and the health of our people. But I have to make sure that we are, again, placed in a much confident level and much assurance level that we have contained and fought and succeeded in fighting this coronavirus.
Thank you, Kevin. I didn't count that first question against you since you couldn't hear the governor when she was reading the executive order. We'll also provide everybody with a copy of the executive order. Next is PDN Jasmine Weiss.
Happy day, everyone. Thanks for doing this. Can we just get an update on the federal relief benefits? Where are we with that? I mean, people are asking, when can they avail of these things? I'm sure Jasmine, you get it every day.
Jasmine, I made it very clear that we're going to stick with the COVID recovery efforts. So if you
sure.
Thank you.
So have we met any of the triggers for PCOR 1?
We are actually, yes, we are meeting a number of our triggers. Our testing capacity has improved. Our hospital facilities and capacity is such that we can take care of our population. our contact tracing is actually also robust and moving forward. And what was the other one? Cases. Our cases, we are testing more, and our cases are showing good numbers. And so if we can maintain and contain our cases moving forward, we will then make a decision to lift some of the restrictions that are in PCOR 1.
So with the contact tracing, the White House a couple weeks ago said that there will be like CDC teams that will be sent to all the states. I'm wondering if Guam was included in that. Did we get any team of CDC members to help with contact tracing?
Yes, we are. Yes, we are included, and there are some here on island already.
Thank you, Jasmine. And if you have questions outside of today's COVID recovery plan presentation, we'll be more than happy to answer your questions afterwards. I-94, Adriana Cotero.
Hi, everyone. So, Governor, according to documents obtained by KUAM, the Pacific Star Hotel charged public health $544,600 for the use of 389 hotel rooms for 2 weeks from March 23rd to April 5th. Meaning at that rate, public health would have paid over $1.6 million for the use of the hotel for the last 6 weeks. We also know by researching yours and Lieutenant Governor's campaign finance documents that through the Guam Election Commission, the family who owns Pacific Star donated thousands of dollars to your campaign. This giving the appearance of political favoritism. So Public Auditor BJ Cruz told KUAM that through their emergency procurement and during this process for the pandemic, something they'll be looking very closely at is Hi, sorry, I wasn't finished.
Go ahead, keep going.
Okay, so how would you answer any critics who say politics is playing a part in procurement during this public health emergency?
Okay, Adriana, as I said, we made it very clear that your questions need to stay relevant to the topic at hand. We're going to go to the next media, K57, Patty Arroyo.
Good afternoon, everyone. Just a follow up to the question about regressing. Every transition will allow the relaxation of restrictions. If after there's more socialization and new positive cases turn up, you're saying that regressing would depend on the number of positives. So how many would be too many? I know you haven't completely figured out that plan, Dr. Hernandez, but how many would be too many?
Hi, Patty. This is Dr. Cabrera. The best way I can answer that question is that right now we're at a very low rate, which is almost zero. And so the way that we would advise the governor is based on the trend overall. So, one day there may be 8, and that might be a single day where there's only 8. That's higher than what we are right now. But if it comes back down and it's controlled very well and it's an outlier, then we're not going to regress just because of those 8 cases in one day, for example. So it's really, but what we said in the presentation is that activity of positive cases that come up, below 5 per day is for the most part still considered stable. But again, it's the whole trend, and we have to look at the whole picture. It's also the other reason why we're using what's called 5-day rolling averages. And that gives us a more clear picture, so to kind of decrease the noise that we may get from variability from day to day, so that we can get a more comprehensive picture and not be so reflexive and be more thoughtful in the process. So I hope that answers that question.
Yeah, it does the best that it can be at the moment. I have another question about when we transition between these conditions of readiness, who will monitor for compliance? I mean, can you enforce, and who does enforcement? Can you shut a business down, for example? And who would do all that monitoring? Who would actually physically go out and see that people are complying with the terms of each of these conditions?
It would be, I think, in conjunction of public health and also the Department of Revenue and Taxation.
Thank you, Patty.
Next is The Point, Nick Delgado.
Hi, Hoppaday. Can you guys hear me?
Yes, we can hear you.
All right, great. So this is in response to those people self-monitoring the businesses that reopened during the recovery process. Considering public health didn't have enough staff prior to the pandemic to handle their inspections of local businesses, how will we be able to handle the mass influx anticipated for public health to approve some of these locations, even if it's by that May 9th deadline?
You know, public health does have the personnel, and especially if we are going to be monitoring compliance to these lifting of restrictions. Public health will be that entity, and they will make sure that they have the necessary personnel and human resources to do that. Additionally, Nick, we will also be looking at the cases. We will also be monitoring how many cases we're having. That's a measure, a trigger that we are going to be looking at. And from monitoring those cases, then we can have an idea that some of our measures that we lifted may not be working. And so we might have to put those restrictions back in place again. And so the key monitoring here would be the number of cases. And if there's a surge, then we definitely would have to review our measures, and those that we feel is not working, then we will resort to initiating that measure again. Remember that the process is going to be testing, monitoring the cases, contact tracing, and then lift. Once we lift a restriction, we will again monitor very closely the cases by doing more testing and also doing contact tracing. So that's the overall mechanism that we will be using through this pandemic, through this Challenge para Hinemlo recovery plan.
If I could add, Nick,
Yes.
just regarding, just specifically to your question, you know, the recovery panel of advisors really talked about that, the point you made as it relates to compliance and monitoring, and you know, with the discussion from the business community, or the business community that were represented in that recovery panel of advisors. They felt that, in conjunction with the Chamber of Commerce and the Women's Chamber of Commerce, would hope that, you know, where we got to today is because of everyone's trust and respect for each other in terms of social distancing and wearing face masks and things like that. And so the idea was that of a little bit less regulation and a lot more self-regulation. And so if there are you know, bad apples, obviously we'd like to ensure that that's identified, and everyone is going to be helping each other, businesses and governments and individuals, toward that self-regulation goal. And so obviously balancing the resources of the government and trying to utilize the resources of the community to combat the continued spread of the virus is really the goal here. And that's kind of the balance that the panel of advisors had really hope to achieve.
Yeah, it definitely sounds like a very tedious task to determine whether we're going to lift some of those restrictions and then potentially take them back. And so thank you for that explanation, Dr. Hernandez. And so on that note, I wanted to hear just a little bit, Governor, if you could talk about the role of some of those, the members on that recovery panel who's worked hard to put this together. And specifically, I want to ask, what was the role of your Chief of Staff, Tony Babalta, who yesterday we heard was placed in, or had to stay the night at the quarantine facility because he wasn't feeling well, and has he been tested?
Again, Nick, we have to stay at the topic.
The topic is again in regards to the role of one of the members, the Chief of Staff, and then on that note, the update in regards to his stay over at the Pacific Star, because a lot of people find that very questionable. Although he might have had good intentions, there's still the question out there of
Nick, and as I understand, Crystal did respond to you earlier that we would be providing you with a written response to that question. Thank you.
So the role?
We're going to go to Mariana's Business Journal next. Wayne Chargaloff, thank you.
Hello, good afternoon, everyone. As Guam begins to move through the different P cores, as businesses start to open up and public spaces start to reopen, how will that affect surveillance of the disease itself? How will that affect monitoring and tracking of its progression and presence in the community?
So with our recovery plan and of course, our program right now in dealing with the coronavirus, testing is very key. And so testing with making sure that we diagnose and monitoring more. When we get into the level of surveillance, we will also continue doing testing to again monitor surveillance, to monitor the community spread, to monitor the positivity rates of our cases. And so testing puts a really very significant role in the monitoring process and the surveillance.
Okay, so it'll be primarily then through the testing protocols you're using now. Different governments in the world, such as France and Italy, have been using mobile apps so that people can self-report symptoms and that kind of thing. Is that something that the government has looked at as far as surveillance of the disease?
Yes, Wayne, that's a very good question, and thank you for that. We are going to be implementing the Safe Path, Safe Place surveillance app, which is being used by other countries. And we should be ready to implement that, I think, within the week, or at least next week. And this is exactly what you are saying. We will be able to locate where people have had contact with people that are positive tests. So through that, and through working with public health and this implementation of this app, we would be able to actually let people know who have the app exactly that they were at a certain place and they were there for 2 hours, and there's the possibility that they have been in contact with a person who is positive COVID-19. And so it's a big coordination with public health and also the community in volunteering to install and also to meet the requirements of this application.
Thank you, Wayne. Guam Daily Post, John O'Connor.
Thank you, Governor. So we know that Department of Public Health is currently doing the expanded testing, and even after this week, we're anticipating that they're going to be testing frontline workers, homeless individuals, and moving on into congregate buildings and testing those individuals. So and forgive me if I misheard earlier statement, but this might lead into additional cases. So as we transition from one P core to another, maybe I misheard it earlier, but why isn't there a specific plan with regard to regression?
The plan, regression is going to be dependent on what our cases are at the time that we are monitoring. It's going to be dependent about, are there surges? Can we address those surges? And if we lift a restriction and continue the testing and we see that there's more people coming in as positive, then that's saying to us that the measure that we lifted may not be working. It's not succeeding. And people may not be social distancing. People may not be decreasing their contact. They might not be following quantities of social gathering. And so those are things that we would look at. And if we feel that a measure is not being met, then we are going to go back and reintroduce that measure. So I think although there's no the guideline for the regression is going to be the number of cases and our ability to meet the 4 criteria. That's going to be our guideline for regression from one PCOR to another backwards.
Yeah, and just so I can add to Governor, you know, the discussion of regression was not something we forgot. It was something that we thought about, and we decided obviously to not include it in this specific guidelines at the moment. But we also wanted to make sure that there was some flexibility. I mean, in the onset, you know, we're hoping that people can look forward to positively moving forward. And so, in terms of wanting to know when we will move back, I think what might be more important, hopefully to everyone, is that we continue to be diligent in our social distancing and in ensuring that we prevent the spread of the virus. And so, in terms of the regression and possibly moving back, we hope that doesn't happen, and there's a lot of trust that that everyone is that's being placed in everyone. And so, in terms of the regression, if there was something as it relates to hospitalization, there weren't any specific triggers that we'd like to identify, because it's kind of everything as a whole. So the role of contact tracing and testing is very key, because as movement grows in the community because of the lifting of restrictions, the robustness of testing and contact tracing is important, because if there are any issues in terms of top positive test cases, for example, and people's movements into, let's say, for example, restaurants, if that does open at some point, you know, in terms of trying to ensure that we all work together, businesses, for example, some have mentioned that they'll have patrons possibly sign in, and that's helping for the contact tracing, just in case something may occur and that a positive test may occur, and public health would need assistance in terms of tracing that positive and everyone in that restaurant or place of business. And so all of these together, it was really difficult to determine what parameters one would take, or what those parameters would be that would indicate a movement backwards. And so, as the governor mentioned, we're using the guidelines moving forward as guidelines. But in terms of specific triggers, that's something that will have to be monitored on a daily basis. And so, we're hoping that everyone's looking forward to moving forward instead of worrying about moving backwards. And so, if we're all looking forward to moving forward in this PCOR levels, then hopefully, you know, that's kind of the mindset that we have. So hopefully I added to that question.
Could I just add, we're very, very confident that we have contained our virus. And the reason we are confident is because of the numbers that we're seeing. And these numbers have been sustained and will continue to be sustained. And most importantly, if you look at, well, why did Hokkaido that opened now had to close again? Because there was the resurgence. That's something that we don't want happening. And that's why we're very, very careful that we don't prematurely lift restrictions all of a sudden. That's why we don't want to lift restrictions quickly. That's why when we lift restrictions, we want to make sure we test, we monitor, and we trace them. So additional to that, I think because we have instituted very aggressive, strong measures, and we have instituted them quite early, we didn't see the surge that other countries have seen or other cities have seen. And I think it's because, I know it's because we all work together to make it happen. And so when we move forward after we lift some restrictions very slowly, we're going to watch how our people behave as a result of lifting that restriction. So say, for example, we lift the restriction for the shopping centers. And the shopping centers, the retail stores are saying, okay, we are going to limit capacity in the stores. And then all of a sudden, the behavior of our people is not complying to that. We lifted the roadblocks. And people are already calling me saying, Governor, traffic out here is crazy. So what is that saying? Are we complying to make sure that we stay home and only do essential activities? Those are the kinds of things that we're going to have to be looking at as and making sure that we do comply. Because let me tell you, people are already saying there's going to be a second wave, and the second wave is going to be worse than the first wave, and we have to prepare for the second wave. So I want to prevent going into that second wave, and I can do whatever I can within my legal authority. But if I don't have your cooperation and I don't have your support, we will not be able to do that.
Thank you, Governor. I just want to say, as you were talking at the end there, that the mic was cutting out a little bit. So in preparation for the next question, I just wanted to make note of that. But the second question goes back to the early question from Kevin regarding quarantine. And I think this might be pretty important, since in the background of any discussions regarding recovery, there is the concerns with GovCon's financial health. And obviously, as we've stated before, the quarantine facilities will remain, and we're evidently paying those quarantine facilities. So as we look at moving into PCOR 2 and possibly PCOR 3, will we have to maintain all of the quarantine facilities? And can you give us an idea of how much has already been paid to these facilities, and whether, considering that there are some guidelines from FEMA to reimbursement, whether you're confident we will get reimbursement for all of those costs?
I am confident we'll get reimbursed for those costs, number one. And the quarantine will stay in place as long as we look at the numbers, and as long as we can be assured that when we start bringing in outside people, travelers, tourists, that how am I going to be assured that they're not coming in infected with COVID-19? And that's something that is going to be a challenge in terms of addressing. And I have been speaking to the tourist industry to set down what their plans are. What are they going to do to assure the people of Guam that when we open for tourists, that those people coming in are not going to reinfect our community? It's a very tall thing to get to, but that should be our goal.
Thank you, John. And now for some closing remarks from our governor.
It's easy to feel helpless during this pandemic because we are facing an invisible enemy. For many of us, our role is to do nothing, go nowhere, and see no one. And I know this can be deeply frustrating, but we need to remember why we are doing this and for who. Earlier this week, you heard the recovery story of Elvira Cagle, our oldest COVID-19 survivor at 92 years old. You heard her fears as she was confirmed positive for COVID-19. You heard her hope as she began to recover from the illness. You heard how she turned to prayer and her family. And you heard the support she received from public health every step of the way. Her story is just one of 130 other stories of recovery. Some were able to isolate themselves at home, while others had a tougher fight. Some were under the care of their families. Others had to be separated from their loved ones. Some recovered fairly quickly. Others had a long and slow battle. But all of them showed us the courage, the strength, and resilience we all need to beat COVID-19. In every crisis Guam has endured, we learn that even when problems are insurmountable, by working together for the common good, we will always overcome. While we have not faced anything quite like COVID-19, I know we will get through this, not only for ourselves, but for those who survived this virus. To all of our 130 recoveries, thank you for being our COVID heroes. Thank you, and si Diyos maasik.
Thank you, everybody.